If you're in the final days or weeks of pregnancy and feeling a mix of excitement, nerves, and curiosity, take a deep breath and stay with me. Your body is wise, and it's already sending you gentle signals that your baby is getting ready to arrive. In this video, I'll walk you through the most common and reassuring signs that labor may be close, what they mean, what's normal, and when it's time to head to the hospital so you can feel informed, calm, and confident instead of anxious. Every pregnancy is unique, but understanding these signs helps you trust your body and recognize that everything is unfolding exactly as it should. You're not alone in this moment, and you're doing an amazing job. Before we begin, make sure to like this video and subscribe to the channel so you don't miss our weekly pregnancy guidance and support as you get closer to meeting your baby. Now, let's talk about the 8 signs that your baby may be getting ready to be born. As labor approaches, your body begins to send gentle and meaningful signals that help you recognize when your baby is preparing to be born, allowing you to feel informed rather than anxious. Your body has been preparing for birth for many weeks, and as labor approaches, it begins to communicate more clearly. These signals are not meant to scare you, but to guide you gently into the final phase of pregnancy. Understanding them helps replace fear with awareness. Many pregnant women worry about missing the right moment, but the truth is that your body rarely whispers, it communicates in pattern. These changes may be physical, emotional, or both, and together they create a roadmap toward birth. Rather than focusing on exact dates, it's more helpful to observe how your body feels and behaves. Labor preparation is not a single event, but a gradual process that unfolds naturally. When you recognize these signals as part of a normal transition, you allow yourself to stay calm, grounded, and emotionally prepared for what's ahead. One of the most reassuring truths about late pregnancy is that your body knows what it is doing. Hormones begin to shift, muscles soften, and your uterus prepares itself for the work of labor. These changes happen whether you notice them or not. As these internal adjustments take place, you may start to feel different without being able to explain why. This is not anxiety, it's awareness. Your body is tuning in to the upcoming birth. Listening to yourself becomes especially important during this stage. Rest when you feel tired, slow down when your body asks, and trust that these instincts are meaningful. By honoring these signals, you create a sense of partnership with your body instead of resistance or fear. Approaching labor often brings a mix of emotion, including excitement, anticipation, and vulnerability. These feelings are not random. They are deeply connected to hormonal changes that prepare both body and mind. Your nervous system begins to shift toward focus and introspection. You may feel more sensitive, more aware of your surroundings, and more connected to your inner world. This emotional preparation is just as important as the physical. Birth requires presence, and your body gently guides you. Allowing space for these emotions helps you move into labor with acceptance rather than tension. Physical sensations may also change as labor draws closer. You might notice pressure, heaviness, or a sense that things are settling lower in your body. These sensations are common and meaningful. Rather than interpreting every sensation as a problem, it helps to see them as communication. Your body is adjusting alignment, position, and readiness. These changes often come gradually, giving you time to adapt both physically and emotionally. There is no rush, only progression. Trust grows when you understand that discomfort does not automatically mean danger, it often means preparation. Late pregnancy encourages you to slow down, even in a fast-paced world. Fatigue, the need for rest, and reduced energy are not weakness but protective signal. Your body conserves energy for labor, which requires strength, endurance, and focus. Rest becomes part of the preparation process. By responding to this need for rest, you support your body instead of fighting it. This creates a calmer transition into labor. Rest is not passive, it is active preparation for birth. As labor approaches, your awareness often shifts inward. External concerns may feel less important, while your body and baby take center stage. This inward focus helps you connect more deeply with physical sensations and emotional cues. It also supports decision-making during labor. Rather than seeing this as withdrawal, understand it as readiness. Your mind is aligning with your body's purpose. This internal shift is one of the most powerful signs that birth is near. Your intuition may become stronger during this time. You may feel certain urges, preferences, or instincts without logical explanation. These intuitive signals are rooted in your body's wisdom. They help guide you towards safety, comfort, and readiness. Learning to trust these instincts can reduce fear and increase confidence as labor approaches. Your intuition is not separate from medical care, it complements it. Late pregnancy, often signs may come and go, and not all changes mean labor will start immediately. This unpredictability is normal and helps prevent unnecessary stress. Your body works on its own timeline. Understanding this helps you avoid overanalyzing every symptom and instead observe patterns calmly. Patience allows your body to lead the process naturally. Support becomes especially important during this phase. Sharing your experiences with trusted people can bring reassurance. When others validate your feelings and physical sensations, anxiety often decreases. Birth is not meant to be faced alone, even before labor begins. Connection provides emotional safety as you approach delivery. Recognizing early signs of labor preparation helps transform uncertainty into understanding. Knowledge gives you confidence. When you understand that your body is communicating, you feel less afraid of the unknown. This awareness allows you to approach birth with calm anticipation instead of fear. Your body is preparing you step by step, and you are ready. The loss of the mucus plug is a natural and reassuring sign that your cervix is changing, indicating that your body is gradually preparing for labor in its own perfect timing. The mucus plug plays an important role during pregnancy by protecting the uterus from bacteria. Its release is a sign that the cervix is beginning to. This change does not mean labor will start immediately, but it does indicate progress. Your body is moving closer to birth. Understanding this helps reduce fear when you notice this sign for the first time. It is a normal and healthy part of late pregnancy. The appearance of the mucus plug can vary. It may be clear, cloudy, thick, or slightly tinged with blood. These variations are normal and do not necessarily signal an emergency. What matters is recognizing the change. Knowing what to expect prevents unnecessary panic and allows you to respond calmly. Observation is more important than alarm. Some women lose the mucus plug weeks before labor, while others lose it during active labor. Both experiences are normal. This variability highlights the individuality of pregnancy and birth. There is no single timeline that applies to everyone. Your body follows its own rhythm. In some cases, the mucus plug may regenerate if labor is still far away. This is especially common if it is lost early. This does not mean something is wrong. It simply reflects the cervix adjusting gradually. The body is flexible and responsive. Trusting this process reduces unnecessary worry. The release of the mucus plug often coincides with cervical softening and dilation. These changes prepare the cervix for labor. They happen slowly and steadily, often without pain. This gradual preparation protects both mother and baby. Progress does not need to be dramatic to be meaningful. Losing the mucus plug can feel emotionally significant. It often makes pregnancy feel more real and imminent. These emotions are valid and common. Excitement and nervousness often coexist. Acknowledging these feelings helps you stay emotionally balanced. Emotional readiness grows alongside physical readiness. While the mucus plug itself is not a reason to rush to the hospital, it is a signal to stay attentive. Monitoring other signs, such as contractions or fluid leakage, becomes more important. Awareness allows you to respond appropriately when labor truly begins. Knowledge supports calm decision-making. Healthcare providers often reassure patients that mucus plug loss alone does not require intervention. This reassurance is based on evidence and experience. Understanding this prevents unnecessary stress and hospital visits. .com observation is sufficient. Late pregnancy is full of small transitions that prepare you for birth. The mucus plug is one of these. Each sign builds upon the last, creating a clear pattern over time. Seeing these signs as part of a sequence brings clarity. Birth is a process, not a moment. Recognizing the loss of the mucus plug as a normal milestone helps you feel empowered rather than fear. It is a reminder that your body is doing exactly what it needs to. Trust grows when you understand what is happening. Your body is preparing gently and wisely for your baby's arrival. A noticeable change in the shape and position of your belly often reflects your baby settling deeper into the pelvis, which can bring relief in breathing and digestion while signaling that birth is getting closer. As the final stage of pregnancy approaches, many women notice a visible change in the shape and position of their belly. This shift often happens gradually and reflects an important step in preparation for birth. Your baby is beginning to move lower into the pelvis, a process commonly known as engagement. This change does not happen overnight for everyone. Some women notice it weeks before labor, while others experience it much closer to delivery. Both experiences are completely normal and healthy. The baby settling lower allows the body to prepare mechanically for birth. It is your body aligning itself with what is coming next. Recognizing this change as a positive sign can help replace uncertainty with reassurance. When the baby moves deeper into the pelvis, many women experience physical relief, especially in breathing. Pressure on the diaphragm decreases, allowing fuller and more comfortable breaths. Eating may also become easier as digestion improves slightly. Meals that once felt heavy may now feel more manageable. These small improvements are signals that your body is redistributing pressure in preparation for labor. Even subtle relief can feel significant after weeks of discomfort, reinforcing that your body is working intelligently. Although breathing often improves, new sensations may appear as the baby settles lower. Increased pelvic pressure is common and completely expected. You may feel heaviness, fullness, or a pulling sensation in the lower abdomen. These feelings reflect your baby's position changing, not a problem. Your pelvis is adapting to support the baby's weight as labor approaches. Understanding these sensations helps you interpret them calmly rather than with concern. One of the most noticeable changes after the baby engages is increased pressure on the bladder. Many women find themselves needing to urinate more frequently. This happens because the baby's head rests closer to the bladder, reducing its capacity. While inconvenient, it is a normal and temporary change. Staying hydrated remains important, even if bathroom trips increase. This pressure is a sign of readiness, not something going wrong. It is important to distinguish between the baby being head down and the baby being fully engaged. A baby can be head down without yet settling into the pelvis. Engagement means the baby's head has moved into a lower, more stable position. This often leads to visible changes in belly height. Understanding this distinction helps manage expectations and reduces confusion. Both positions are part of the normal journey toward birth. Some women notice changes in posture or walking as the baby settles lower. The center of gravity may shift slightly, altering balance. These adjustments are the body's way of maintaining stability and comfort. Moving more slowly and deliberately becomes helpful. Listening to these physical cues helps prevent strain and supports comfort. Your body instinctively adapts to protect both you and your baby. Emotionally, noticing the baby drop can make the birth feel more real and immediate. Many women experience a mix of excitement and vulnerability. These emotions are natural responses to recognizing that labor is approaching. They reflect awareness, not fear. Taking time to acknowledge these feelings can bring emotional grounding. Preparation happens both physically and emotionally at this. Not every woman experiences a dramatic or visible belly drop, especially in second or subsequent pregnancy. Muscles may already be more flexible. This does not mean labor is not approaching or that something is wrong. Every body responds differently, and progress cannot always be seen from the outside. Trusting your unique experience is essential. Healthcare providers often assess engagement during prenatal visits, but your own observations are also valuable. Changes in comfort, posture, and pressure often tell the story just as clearly. Paying attention without obsessing allows you to stay informed without anxiety. Balance between awareness and calm observation. The baby settling into the pelvis is one of the clearest signs that your body is aligning for birth. It reflects cooperation between your body and your baby. This process happens naturally and does not require effort or intervention in most cases. Recognizing it as a step forward builds confidence and trust. Your body and your baby are preparing together exactly as they should. Regular, rhythmic, and increasingly intense contractions are one of the clearest signs that labor is beginning, helping you distinguish true labor from earlier practice contractions with confidence. During pregnancy, many women experience contractions long before labor truly begins. These early contractions, often called practice contractions, help the uterus prepare without leading to immediate birth. As labor approaches, contractions begin to change in a noticeable way. They become more organized, more predictable, and more meaningful. Instead of coming and going randomly, they start to follow a rhythm. This rhythm is one of the clearest indicators that labor may be beginning. Understanding this progression helps reduce confusion and unnecessary stress. True labor contractions tend to grow stronger over time rather than fading away. They may begin as mild discomfort and gradually become more intense. Unlike earlier contractions, they usually do not disappear with rest, hydration, or changes in position. This consistency helps distinguish true labor from false alarm. Recognizing this pattern allows you to respond with calm confidence. Another important change is the spacing between contractions. In early labor, intervals gradually shorten as the uterus works more efficiently. At the same time, each contraction tends to last longer. This combination of shorter intervals and longer duration signals progress. These changes reflect cervical dilation and active preparation for birth. Observing these patterns provides clarity during a time that can feel uncertain. Pain perception during contractions also evolves. Early discomfort may feel manageable, while later contractions require focused breathing and stillness. This increase in intensity is purposeful. Stronger contractions help move the baby downward and open the cervix. Pain in labor is not random, it has direction and meaning. Understanding this can transform fear into focus. Breathing becomes a powerful tool as contractions intensify. Slow, deep breaths help calm the nervous system and support oxygen. Many women instinctively lean forward, sway, or pause during contractions to find comfort. These movements are natural responses to labor sensation. Trusting your body's instincts helps you cope more effectively. Timing contractions can be helpful, especially when deciding when to go to the hospital or birthing. Healthcare providers often recommend paying attention when contractions become regular and closer together. This guidance is meant to support safety, not create urgency. Knowing when to seek care allows you to stay calm and prepared. Living farther from your place of birth may influence when you choose to leave home. Longer travel time often means earlier departure. These decisions are practical and personal, guided by patterns rather than fear. Planning ahead reduces stress when labor begins. Preparation creates peace of mind. It is normal to question whether labor has truly started. Many women experience moments of doubt. This uncertainty does not mean you are doing something wrong. It is part of the process. Over time, patterns become clearer and confidence grows. Labor reveals itself through support during contraction makes a meaningful difference. Having someone nearby can provide reassurance and grounding. Emotional support helps you stay focused and calm. Labor is not meant to be navigated alone. Connection brings strength. Recognizing true labor contractions empowers you to trust your body's signal. With understanding comes confidence and emotional readiness. Labor unfolds step by step, not all at once. Your body leads and you follow with awareness. Digestive changes, including temporary diarrhea before labor, are a normal and purposeful way your body creates space for birth, reminding you that every system is working together for this moment. As labor approaches, the body begins to clear space internally in preparation for birth. One way this happens is through digestive change. Temporary diarrhea before labor is common and normal, even though it can feel surprising. This response helps empty the bowels, allowing more room for the baby's descent. It is a functional and purposeful process. Hormonal changes play a key role in these digestive prostaglandins, which help soften the cervix, also affect the intestine. As a result, bowel movements may become more frequent or urgent. This is not a sign of illness, but of preparation. The body is coordinating efficiently. Not every woman experiences this symptom, and its absence does not mean labor is not near. Each body responds differently to hormonal changes. Variability is normal and expected. There is no single checklist that applies to everyone. Experiencing digestive changes close to labor can feel uncomfortable or even embarrassing, but it is very common. Healthcare professionals are accustomed to this and view it as normal. There is no shame in how the body prepares for birth. Understanding this helps reduce self-consciousness. Staying hydrated becomes especially important if digestive changes occur. Water supports energy levels and uterine function. Light, nourishing foods may feel more comfortable during this time. Listening to your body's preferences helps maintain balance. Self-care supports readiness. Digestive clearing may also continue during labor itself. This is a natural response to the intense physical effort involved. Pushing during birth uses many of the same muscles as bowel movement. This overlap is normal and expected. Medical teams are fully prepared for this. Understanding this process ahead of time reduces fear and surprise. Knowledge allows you to approach labor with acceptance rather than worry. Preparation includes knowing what is normal. Normalizing these experiences brings emotional ease. Digestive changes are just one of many signs that systems are aligning for birth. Muscles, hormones, and organs work together in a coordinated way. Birth preparation involves the entire body, not just the uterus. This collaboration reflects biological wisdom. If digestive symptoms are accompanied by severe pain, fever, or dehydration, medical evaluation is important. Knowing when something feels outside the norm helps protect safety. Awareness supports appropriate action. Trusting your instincts remains essential. Seeing digestive changes as purposeful helps you feel more at ease with your body. It is another sign that labor preparation is underway. Your body is clearing the way literally and figuratively. Everything is aligning for birth. A decrease in your baby's movements near the end of pregnancy can be normal, as your baby conserves energy for birth, while still requiring mindful observation and trust in your instinct. As pregnancy reaches its final stage, many parents notice a change in how often their baby moves. This shift can feel concerning at first, especially if movements were previously strong and frequent. In most cases, this change happens because the baby has less space to move freely. The uterus is now full, and movements may feel different rather than absent. Your baby is also preparing for birth, conserving energy for the work ahead. Understanding this context helps reduce unnecessary fear. Late pregnancy movements may feel slower, more deliberate, or more subtle. Rolls and stretches often replace sharp kicks. This does not mean your baby is less active, but that movements have changed in quality. Awareness of movement patterns is more important than counting dramatic motion. Your familiarity with your baby's rhythm is key. Babies often rest for longer periods. Toward the end of pregnancy, sleep cycles become more defined. During these quiet times, movement may be less noticeable. This rest is part of healthy development and preparation. Periods of stillness are normal when balanced with regular activity. While reduced movement can be normal, complete absence of movement is not. If you notice no movement over several hours, gentle stimulation can help check responsiveness. Eating something sweet, changing position, or lying on your side may encourage movement. If there's no response, medical evaluation is important. Healthcare providers emphasize trusting your instincts when it comes to baby movement. You know what feels normal for your pregnancy better than anyone else. If something feels off, seeking reassurance is always appropriate. It is better to check and be reassured than to ignore concerns. Monitoring movements is not meant to create anxiety, but awareness. Simple observation throughout the day is often sufficient. There is no need for constant counting unless recommended by your provider. Calm attentiveness supports confidence. Babies preparing for birth often conserve energy, much like an athlete resting before an event. This conservation allows strength and coordination during labor. Reduced movement can reflect this preparation. Seeing it this way helps normalize the experience. Emotional reassurance plays an important role during this stage. Talking to your baby, resting, and staying connected can bring comfort. Emotional calm supports physical awareness. Your bond continues to grow even in quiet moments. Any sudden or dramatic change in movement patterns should be evaluated. This does not mean something is wrong, but that assessment is prompt evaluation supports safety for both mother and baby. Timely care brings peace of mind. Understanding late pregnancy movement changes empowers you to respond calmly and appropriately. Awareness replaces fear when paired with knowledge. Your instincts and medical support work together. This balance helps you approach birth with confidence. The sudden urge to organize, clean, and prepare your baby's space often. Called the nesting instinct is a common emotional and hormonal response as your body and mind prepare to welcome your baby. Many pregnant women experience a sudden burst of energy near the end of pregnancy. This energy often expresses itself as an urge to clean, organize, and prepare the home. This behavior is commonly known as the nesting instinct. It is a normal and meaningful response. Hormonal shifts play a major role in triggering nesting behavior. These hormones prepare both body and mind for caregiving. Organizing the environment creates a sense of readiness and control. This emotional preparation supports confidence. Nesting can include washing baby clothes, preparing the nursery, or organizing hospital bags. These tasks provide focus and purpose during the final days. They also help direct nervous energy into productive action. Preparation brings reassurance. Not everyone experiences nesting in the same way. Some feel an intense urge to prepare, while others feel only mild motivation. Both experiences are completely normal. There is no correct way to nest. It is important to balance nesting with rest. Overexertion can lead to fatigue or discomfort. Listening to your body helps prevent strain. Rest remains an essential part of preparation. Emotionally, nesting often brings a sense of closeness to the baby. Preparing the environment strengthens the emotional bond. It can feel grounding and comforting. This connection supports emotional readiness for birth. Nesting behavior may appear shortly before labor begins. For some, it happens days before birth. For others, weeks. Timing varies widely and does not predict exact labor onset. It is one piece of a larger picture. After bursts of nesting energy, many women experience deep fatigue. This contrast is normal and reflects energy cycle. Both activity and rest play important roles. Balance supports overall well-being. Sharing nesting tasks with a partner or support person can be helpful. Delegation reduces physical strain. Support strengthens emotional security. Birth preparation is a shared experience. Nesting is a sign that your mind and body are aligning for birth. It reflects readiness, care, and anticipation. Recognizing it as normal helps you embrace the process. You are preparing in ways both seen and unseen. Understanding the signs of imminent labor helps replace fear with awareness, allowing you to trust your body, feel supported, and approach birth with clarity and emotional readiness. As labor approaches, understanding what your body is experiencing can make a profound difference in how you feel. Knowledge transforms uncertainty into reassurance. When signs of labor are familiar, they feel less frightening and more manageable. Awareness creates emotional safety. Instead of reacting with fear, you can respond with calm observation. This shift in mindset supports a more peaceful birth experience. Trusting your body becomes easier when you recognize its signals as purposeful. Each change has meaning and direction. Your body has been preparing for birth throughout pregnancy. Labor is not a sudden event, but a culmination of many steps. Understanding this progression builds confidence. Feeling supported emotionally and medically plays an essential role during this time. Support allows you to rest, ask questions, and seek reassurance without hesitation. You do not need to face uncertainty alone. Connection strengthens resilience. Approaching birth with clarity helps you make informed decisions. When you understand what is normal, you can identify when care is needed. This balance between trust and awareness supports safety. Confidence grows through informed choice. Fear often comes from the unknown. Education replaces fear with understanding. Knowing what signs to expect helps reduce anxiety. Preparedness allows you to focus on the experience rather than worry. Calm creates space for trust. Emotional readiness is just as important as physical readiness. Accepting the process allows you to stay present. Presence supports cooperation between mind and body. Birth unfolds more smoothly. Fear is reduced. Each labor experience is unique, shaped by individual bodies and circumstances. There is no single right way to feel as birth approaches. Trusting your own experience supports emotional well-being. Your journey is valid. Listening to your instincts remains essential. Even with education, knowledge and intuition work best together. If something feels wrong, seeking help is always a Trusting yourself supports safety. Calm awareness allows you to welcome labor rather than resist it. Acceptance reduces tension and promotes comfort. Your body responds positively to a sense of safety. Peace supports progress. Understanding the signs of imminent labor empowers you to approach birth with confidence. Awareness replaces fear with trust. You are prepared, supported, and capable. Your body knows how to bring your baby into the world.